All right, we're going to go ahead and get started. Welcome, everyone. I'm Elizabeth Skoy. I'm faculty here at North Dakota State University School of Pharmacy, as well as the director for our CAP Center. Thanks to everyone for joining us. I know for pharmacy, Mondays, and especially Monday around noon, is not always the best time to hold a webinar, but we are recording this. So if you need to step away and come back, or for those of you that are watching this delayed, we completely understand, and we'll have this recorded and available on our website. So we'll be providing some more detailed information to you on that. As well as this is also the time that just worked best for our speakers. We just kind of found out about some of this new news that we're sharing with you today. Not too long ago, we wanted to make sure we got all this information out to you in a timely fashion. And so this was kind of this is what worked best for everybody to get out the news quickly. So with that, I'm going to go over just the kind of the details of our webinar today. So we have a variety of speakers. Myself and Tiffany Knopf are going to just be introducing yourselves and just, thanking you for attending and why we're having this today. And then we have some other speakers that you can see here that are each going to touch on their own area of expertise. As we go through the webinar, if you have any questions at any time, feel free to put them in the chat. Lisa Nagel, our Director of Operations for the CAP Center, is going to be monitoring the chat, and then she'll be reporting out those questions. So you can either put those in the chat, or you can also direct message her if you'd like to. And then also at the very end, we'll also just kind of be pausing for other Q&A. So if you're the type of person that would rather raise your hand or unmute yourself and ask the question directly, you can definitely do that as well. I'm going to put a little plug in. This is our first symposium, our first webinar, I should say, of a series of webinars that we're going to be hosting over the next year that have to do with pharmacy's involvement in chronic disease. So please be looking for other announcements and information from us on those. And then also, this is a really exciting opportunity. This is kind of something that's kind of come to fruition, and I'm going to not steal the thunder from Tiffany, but just to know that this is a topic of conversation that came up at a CAP Center symposium that we had last fall in September of 2022, where we started some really great discussions in general about pharmacy reimbursement and some barriers to billing with Medicaid. And our partners at North Dakota Medicaid have really worked really wonderfully with the other entities to kind of move some of this forward. So really excited about the opportunities that we'll have. So with that, we're going to go ahead and I'm going to turn it over now to Tiffany. And Tiffany, if you wouldn't mind, just kind of, you can go ahead and share your welcome.
Sounds great. Good morning or good afternoon now, everyone. I am Tiffany Knopf. I'm the Health Systems and Pharmacy Coordinator for the North Dakota Department of Health and Human Services, and I am also the Chronic Disease Director for the state of North Dakota. And I truly just want to welcome you all on behalf of the Department of Health and Human Services. I am in the Health Promotion and Chronic Disease Prevention Unit, and so on behalf of us, welcome. I do have to say this started for us 5 years ago when our hypertension and diabetes funding allotted dollars for us to focus and target our chronic disease efforts with pharmacy. In North Dakota, this has been an amazing opportunity that truly I can't even begin to think back 5 years ago that I was so scared. I was so nervous. I had no idea what to expect. And honestly, between Dr. Skoy and Dr. Rue, they truly guided us through this effort. And it has become one of my favorite projects, not that I'm biased, but one of my favorite projects over the last 5 years. And it has far exceeded any expectations we could have ever fathomed 5 years ago. And then, of course, fast forward, as Dr. Skoy said, to the amazing CAP symposium, where I was able to sit down with the North Dakota Medicaid staff and say, we have some really common efforts and we have some really great data coming out of our pharmacy work with chronic disease. How can we link arms and try to make some of this happen? So from data polls to lots of conversations to kind of just really thinking outside of the box, we are so happy that they were able to move forward with some of the recommendations and changes that we'll talk about today. So thanks so much, Dr. Skoy and the team, for having me.
Wonderful. Thanks, Tiffany. So with that, we're going to turn it over to our first speaker from North Dakota Medicaid. Lanika, I'll let you kind of introduce yourself and then let me know as you would like me to progress through your slides.
Will do. Thanks,
Liz. Hi, everyone. Lanika Rorick. I am one of the pharmacists with North Dakota Medicaid. For those of you who are providing services, you've probably seen my name on some of the correspondence that's come out regarding some of these updates recently. But kind of going back to what Tiffany said, the symposium is where we really were able to connect and get some additional feedback about some of the things that pharmacists were finding as issues when they were billing MTM services to Medicaid. So we did try to make some updates this year, and I'll go over those with you here. And then also we wanted to talk about some additional billing opportunities so we can continue to help support some of the great work that Tiffany and the CAP Center are doing to help highlight what pharmacists can bring to the table as a provider. We're really uniquely positioned in our profession to have frequent interactions with patients and really provide a different avenue of services where we just can engage them in a different way. So we'll start with the MTM program updates. If you want to go ahead and move forward, Liz, thank you. Over the course of 2023, we've had a few different things that have happened. This slide is here just to give you an overview of that, and we'll touch on each one of these in just a minute. But starting in the first of the year, Blue Cross Blue Shield implemented their MTM services medical policy for expansion members. Fast forward a few months and the COVID public health emergency ended. So there were some changes to how we were making allowances for delivery of services for COVID and how that's going to affect delivery of services now post public health emergency. And then in July, we were able to get our state plan amendment or our SPA updated to make some of the changes that we were alluding to before that are hopefully going to make it a little bit easier for you to provide services, and then also to continue to operate more at the top of your license and get reimbursed for those services with you being the provider. Liz, if you want to go forward, we'll pop into what happened 1/1 of 2023. So as I mentioned, Blue Cross Blue Shield announced that they had released or put out their policy for MTM services. They did structure their program a little bit differently than we did for the traditional population. So I've included a screenshot here for you what that criteria looks like. Their approach was more towards a minimum number of medications, chronic disease states, or referral. Those policies do update periodically. So I've also included some links down in the lower left corner for your reference, so you can pull those up later if you need to. The other thing to note is that they do require pre-certification for the expansion member group. So you do still have to get authorization for that group to provide MTM services. Blue Cross also requires full provider enrollment through North Dakota Medicaid, as well as their own credentialing process for providers, which the credentialing process, if you are providing immunizations and have been billing for that, you should already be familiar with that process. So that shouldn't necessarily be anything new to you on the Blue Cross Blue Shield credentialing side of things. We can go ahead and move to the next slide, Liz. Thank you. Okay, and as I had mentioned, when the public health emergency had ended, there were some allowances that were being made for telephonic delivery of services. We have carried some of that through, but made some changes in relation to new patients. So if you're having a new patient come in for a first encounter for MTM, we really thought there was value in seeing that patient, what their person looks like, how they're storing their medications, if you need to maybe counsel on how to administer or evaluate technique. We wanted you to be able to have that face-to-face interaction on the front end. So if you're doing an initial encounter, the 99605 CPT code, when I say face-to-face, that can be you're seeing them right in front of you, or you have that telehealth or telepharmacy set up where you have that real-time two-way audio and visual component to the service. With a follow-up where you have an established patient, we thought that an audio-only telephonic encounter could probably be okay in those situations. So we have allowed for that to continue on the 99606 code, and then also that time augment code 99607.
Some things to keep in mind though, when you're billing for those services, they do require certain modifiers, and I don't want to get too into the billing side of it. I included a screenshot here because I wanted to direct you to a really great resource for any pharmacist or any provider who's going to be billing medical claims. So in that lower left corner, I included a link to the general information for providers, which is where that screenshot on the right came from. And that document just goes through a whole host of things you should really be familiar with if you're going to be doing medical claims. So please do take a peek at that reference. If you have questions, I'm certainly here as a resource, or you can always reach out to our general number as well. And then the second link I've included there is the Pharmacy Medical Billing Manual. And the reason I wanted to include that one more slide, Liz. Nope, forward a couple. There you go. The green one. There you go. Okay, the second one there, the Pharmacy Medical Billing Manual, is something we built out to be a little bit more robust reference, because we realize not all pharmacists are operating in an environment where you have people who are super experienced with medical billing, or even have coders and billers at your disposal. So we wanted to give you an idea of what we expect in terms of types of things you should be documenting through an encounter, CPT codes that are related to various services that we know pharmacists are already providing. It's not an all-encompassing list of the things that pharmacists can do or are doing, but they are things that we have seen come through, and we wanted to make sure we had a reference out there for pharmacists. Okay, we can go to the next slide. In that manual, we just posted a new one last week, or else it will be posted this week, but that reflects a lot of these changes that I'm going to be talking about here. So the MTM program underwent a lot of changes that became effective as of July 1. Now, I know I mentioned earlier that our state plan amendment got updated, which that's a little bit more technical jargon than you need to know, but we had an MTM specific section that outlined the CE requirements that we had for pharmacists providing services. That went away. We had that section completely eliminated and are now just leveraging a different section that says pharmacists can basically do services within their scope of practice. So in eliminating the CE requirement, we also could remove the MTM credential that we had as a separate process before. Now, I want to point out that separate from the Blue Cross Blue Shield provider credential that you have to use for expansion, this was a separate credentialing process. So hopefully that's going to streamline things a little bit for everybody. And then through all of that, we also could take off service authorization by requiring full provider enrollment. So what does that mean for you? Well, that means if you enroll as a provider, you're going to bill your NPI as the rendering provider. I mean, you're the provider doing the services. So let's have you bill for your service and get reimbursed for your service. And through that, you don't have to do the service authorization anymore. We were able to do some things on the back end to where we don't need to require that before you do the service. So hopefully that's going to make things a little bit easier too. So then the question is, well, how do you know if it's medically necessary to do MTM? What we did was, well, let me start here. If a pharmacist thinks MTM is medically necessary for a patient, we want to support that. So we added in the MTM patient identification worksheet into the manual that I mentioned on the previous slide. So hopefully that will help give you some guidance. Again, if something's missing, let me know. We miss things sometimes. If there's an area where you think that it should be in there, let me know. We can definitely build it out. And you can always ask us questions if you're not sure. But for the most part, if you think it's medically necessary, we think your professional judgment is worth something. So we tend to agree with you. Liz, if you want to go to the next slide, these are some snips of the different categories that we've put into that identification worksheet. On this first slide, it's mostly medication use related types of things. Some of these you should be pretty familiar with if you've been doing MTM already under Medicaid, like the adherence related problems. That's not new, but we've added some additional things that we've heard come up time and time again, like, well, my patient has really a difficult time with language barriers, or there's just a really low health literacy going on here. It takes time away from workflow. You can't necessarily accomplish all you need to in a counseling scenario. If that's the case, know that MTM is an avenue for you to get reimbursed for that extra time that you need to spend with that member. The other thing I want to point out on this slide is the transition of care area got a little bit of an overhaul. We realized that the time frame was very restrictive and we weren't getting any billing for that. So we've expanded that to 2 months and basically said if someone's going from an environment where they weren't managing their meds to one where they are now, then that could fit into that category. So overall medication related types of MTM would kind of fall into these categories here. Then if we go to the next slide. There you go. The left-hand side is more chronic disease state management, which this is hopefully going to tie into what Tiffany was mentioning earlier. Asthma, COPD, and diabetes aren't new, but we added in the guideline-based therapy guidance section because there's a lot of other chronic disease states out there, hypertension, whatever, you name it. If you're seeing therapy that's not optimal for whatever reason, they're missing drug therapy, they have duplicative drug therapy, dosing's not optimized. If you need to intervene, this is a pretty broad category that could give you a lot of opportunity to bill for the work that you're doing with those members. And then on the right-hand side, that side is more harm reduction focused. So if you've done some naloxone type of work in the past or worked with overdose identification of risk related to that, that area is not going to be new to you. But we've added some things like safer sex practices, other harm reduction strategies for alcohol use disorder or persons who inject drugs. And I want to point those out specifically because we've also updated our hepatitis C criteria and now have an avenue of access for the direct acting antivirals for people who are not necessarily sober and are actively using. So recognizing the value of the MTM in that way, one of the harm reduction strategies that we've added as a criteria for Hep C is MTM for persons who inject drugs or alcohol use disorder. If the member is engaging in harm reduction activities and education, then that's a way for them to get treatment for Hep C if they're currently using. And it also allows pharmacists to be more involved as a provider in that way. But MTM is not all you can do. So let's move on to the next slide and let's talk a little bit more about that. Before I talk about the specific things I have in the manual, I want to call your attention to the right-hand side where I have a lot of tools and links for you. I talked about the general information for providers and pharmacy medical billing manual, but the hhs.nd.gov website is so rich with content and information and how-tos and guidance on how to do things. So please, please go to the website. And if you're looking for something and not finding it, let me know. We're always looking to add to it if we need to, or maybe it's already out there and it's just not accessible for whatever reason. If you're doing services that aren't things that I have listed, you're wondering about, does the CPT code require service authorization? There's an Excel document that's searchable online. You can certainly look at that to find that information. And then what are you going to get paid? We have fee schedules online too that are outlined by code. I think most of the services that pharmacists are going to be doing would be in the professional fee schedule, but there are a few different ones out there. So definitely take a look at those. So as I mentioned before, we updated our SPA. We have general language now for what we can pay for. We can pay for services provided by licensed and registered pharmacists. So if it's within your scope, we can pay for those services if it's a covered CPT code. So what are some things people are doing? We have people doing anti-coag management. We've seen continuous glucose monitoring services. Drug and vaccine administration is something we're all getting pretty good with at this stage. And then tobacco cessation. And those last two, I'm going to talk a little bit more on the next slide about, because not only can you do services related to counseling for those, we can prescribe. So if we want to go to the next slide, we've had some noteworthy things happen in the news. Naloxone went over the counter, and just last week we have our now first non-prescription oral contraceptive. Those are things pharmacists can prescribe, but we also have some other things we can prescribe. Naloxone pre-OTC, but also immunizations and tobacco cessation therapies are things that we, by North Dakota law, are allowed to prescribe. If you want to be the prescriber on those things, there are some things that you have to do. If we want to go to the next slide, Liz. Okay, so I said North Dakota law gives us the authority, but if you want to get paid and you want to be listed as the prescriber, then we have some things at Medicaid that have to be met in order for that to happen. The Social Security Act is a federal law that basically governs when we can pay for things as a covered outpatient drug. So as long as a product's participating in the drug rebate program, if a non-prescription drug is prescribed and it's something that we pay for, then if it's prescribed by a physician or a person authorized to prescribe it, then that's something that you could be listed on that claim as the prescriber. So for instance, if you're prescribing OTC naloxone and you want to be listed as that prescriber, you just have to do what you do, but you have to be enrolled. So that's the thing I want to call your attention to. For North Dakota Medicaid to be able to pay for a claim where you are listed as the prescriber on it, you have to be an enrolled provider. And that's not just pharmacists. If it's a doctor writing the prescription, nurse practitioner, whoever, they have to be an enrolled provider. Now, I'm not saying that you have to be that prescriber. You could potentially be operating under a standing order, or you could just be filling a script from someone else who is prescribing. But at the end of the day, if we want to be, again, operating at the top of our licenses and be listed as those prescriber and identified as a provider, then we need to enroll and we need to actually list ourselves as that prescriber. So I think I've hammered that point enough. Jamie is going to give you a little bit more background on what that enrollment process looks like and share some of his experience with it. So hopefully that's going to help everyone have a little bit easier time if they decide to go through that process. So thank you.
Thanks, Lanika. So yeah, that was a great segue. So we're going to turn over to Jamie now, who's going to give some tips and tricks and kind of go through the enrollment process as a provider.
Yeah, thanks. Thanks, Liz, and thanks, Lanika, for highlighting all these great opportunities that North Dakota Medicaid is making available for pharmacists to practice at the top of our practice. So hopefully you're excited after hearing about these opportunities like I am, and you want to get enrolled if you're not already. And so let's walk through that process a little bit. Like Lanika said, this is the same process that any medical provider goes through to be a provider for North Dakota Medicaid. And there's a lot of information or a number of pieces of information that they request. But if you've applied for anything else in the past or submitted documentation, it's a rather simple process. So enrolling as a North Dakota Medicaid medical provider is a two-step process. The first step is completing an online individual provider enrollment. And then the second step is submitting some additional documentation as proof to go along with that online enrollment, and that documentation includes your license and your NPI and a couple of other pieces of information. If we go to the next slide, we have the CAP Center has put together a guide specific for pharmacists enrolling as a Medicaid medical provider. If Lisa is emailing you out copies of some of the links and stuff afterwards, if you've given her your email, we can also include that resource as well. And we will also be adding this in the near future to our CAP Center webpage. The other thing is that Medicaid has some great resources available that walk you through the process step for step. So that is on their provider enrollment page. The link is on this slide. It's got a number of documents. The two that I want to kind of stress to look at that are very helpful when preparing to apply is the online application guide, because again, that walks you through step for step what you need to do. And then they have some really good YouTube videos that again kind of show you the process. So utilize those resources that are available to you from Medicaid, and then also some of the tips that we put together for you with the CAP Center. Next slide, please. So when you're completing that online provider enrollment, the first thing I want to highlight to you is that after you hit save for the first time on your application, it's going to generate an application tracking number. And that's going to show, as you can see on this screenshot here, that application tracking number is going to show on the top left-hand portion of your screen. And what's nice about that is you want to write that down right away, because you need to use that when you submit the additional documents in step 2. But also, if you ever need to leave your online application, like if you're halfway through and you have to go look something up, or you get called out into the pharmacy, or you have to see a patient and you need to come back to it later, you can resume where you left off by entering that application tracking number. So that will save you some time if you get interrupted while completing the application. So that would be my first tip for you. If we move on to the next slide, I'm kind of trying to highlight some things that I had some questions with when I went through the process, some of my lessons learned to help you all a little bit as you go through the process. Section 2 of the online application is a licensure and certification section. And this is helping to select your taxonomy and also enter your license information. But you kind of have to go through a stepwise process to get the taxonomy generated. It kind of generates it based off of the information that you have already entered. So under that section, under the provider type section or provider type option, you want to select pharmacy. I sometimes scratch my head because I'm like, am I a pharmacy or a pharmacist? What provider type? There's not a pharmacist option. So pharmacy is your option for that. And then in the second portion of section 2 asks to enter the pharmacist license information. And one of the things that you need to enter with that is your date of issuance. And if you're someone like me who's been a pharmacist for quite some time, I don't remember when my license was issued. But thankfully, the Board of Pharmacy has that available on their website. And with that, you want to use the verified license function on the Board of Pharmacy website. Don't use the reprint license, because that doesn't show it on your printed license. But if you use the verified license function, that will give you the date of issuance. And section 3 of the licensure asks for board certification. If you have a board certification, you can enter that, but you also want to enter a board certification of a pharmacist. And that is one of the choices that's available to you. You can use your license number, so you're kind of entering your license twice. But when you do that, then at the very bottom of the screen, when you click to add a taxonomy code, it will automatically populate that pharmacist taxonomy code you see there from a drop-down list. And if we go on to the next slide, I've got a screenshot of what this section looks like. So you can see entering the pharmacist license information, and then also entering a pharmacist as a specialty. And then at the very bottom, the taxonomy code to complete that portion of the online enrollment. If we go to the next slide, then there's again a number of sections that need to be completed, and they're all very simple and straightforward. There's just a few things I want to highlight in a couple of these sections. For example, in section 3, it asks for your provider ID number. And with that, you want to enter your individual NPI. So your NPI as a pharmacist. Don't enter your pharmacy or your practice site's NPI, your location's NPI. Enter your NPI. When we look at service location, there's a number of pieces of information they ask for. You may need to get help from a manager to get some of that information, the manager, owner, depending upon your practice site. And then again, if it's a small practice site, a independent pharmacy, your contacts may all be the same person, and that's okay. When you get to section 5 and have your group affiliation, this is where you use your practice site's Medicaid number. So this is where you will enter the Medicaid number for your site. So 5 is your practice site. 3, you're entering your NPI as an individual. Those are a couple of things to keep in mind with that. And then the rest of it is just answering questions that will be specific to your practice location based on the ownership and any sanctions that have occurred. There's a qualified service provider section that can be skipped because we are not QSPs. And then finally, you'll review everything and submit it, your application. If we go to the next slide, when you submit your application, you'll get a screen that looks a little bit like this screenshot here that will again have your application tracking number on it. It's recommended that you do a print screen, that you print this screen after you submit your application. And then we also recommend that you print the application itself. You can print everything that you've entered, just in case there are questions that come up, you're able to go back and see how you entered everything. And then once that's done, then you can move on to step 2, which is the required documents checklist. And there is a link either on the bottom of your application submission page, or you can complete it online. So a couple of things with this is it's a PDF document. So it's in PDF format. I know on my computer, at least oftentimes in my browser, when I click on a PDF link, it will open the PDF in the browser. And completing this PDF form in the browser, you might have some technical difficulties with that. So my recommendation is to download the PDF from the website and then open it in a Adobe Acrobat Reader or something like that and complete the document in that application rather than trying to do it in your browser. That will ask for your application tracking number. So again, that's the number that you got during your online application. And then with this, it's again pretty straightforward with just providing the information needed. If we go on to the next slide, again, there's a place for you to enter an enrolled billing group. So that would be your practice site and its Medicaid number. There is, again, another checklist and process with some drop-down boxes to populate some fields. So with that, we provided some guidance on what to select for the provider type. Again, there's a number of attestations for other types of providers that do not apply to us. So there you can see you can skip those attestations. It will ask you to attach a copy of your license, and it asks for, again, information that's not on our standard licenses that we get every year when we renew our license with the Board of Pharmacy. So the best route to provide a copy of your license information is, again, to use that verify license and just print a copy of that screen, because that has all of the information that's needed. It will also ask for documentation of your individual NPI. So you can look that up on the NPI registry and do a search for that and just print that screen. After you have that done, again, this sounds like a lot, but it's just collecting the papers and checking the box. It's really not that complicated. Once that's all done, you need to submit your documentation. So your step 2 documentation, you need to either submit that via fax or mail, or you can email it. And then your application will not be reviewed until both of those items have been completed. So until your online application and this additional documentation has been submitted. Once that's done, then you'll get put in the queue for review. And if we go to the next slide, as Lanika said, Blue Cross Blue Shield as the managed care entity for Medicaid expansion also is allowing us to do MTM now as of January 1st. And we've also had the opportunity to bill for immunizations and that as well. We're not going to go in depth into the process to be a Blue Cross Blue Shield provider, credentialed provider, but it's kind of a three-step process. Step one is doing what we just talked about, becoming a North Dakota Medicaid provider as far as servicing Medicaid expansion patients. The second part is credentialing with Blue Cross of North Dakota, and their application is online. We have the link there as well as some additional information. So that's your pathway to also completing this on the Blue Cross side of things. So once you've done all this, what happens next? And on the next slide, we look at that. That may take a few weeks for them to review. They sometimes get, they have a number of providers. Again, this is all medical providers that are submitting to be credentialed that they're reviewing. So it may take a few weeks depending upon how long their queue is for them to review your application. You can see there's a few links that you can use to check where Noridian is at in reviewing the applications. They'll give a date that they're working on. So applications submitted on this date is where we're at. You can check that at that website, or you can check your specific application status in the NMIS portal, again, by using your application tracking number. So that number is important for you to save and print. And then the best thing you can do in the little bit of time that you're waiting from submitting your application to finding out that you are becoming that you've been credentialed as a provider is to get ready to provide these services once that green light goes on and you can go. And with that, I think Jesse is going to help talk about some of the things you can do to prepare for that. So thanks everyone for taking the time to listen to me.
Thanks, Jamie. And just a couple of notes too. Overall, the number of pharmacists that we have in North Dakota that are enrolled as Medicaid providers is really, really low. And so we're really hoping to see that number increase now with the number of opportunities. And I think we still have Linnell on the call, and we asked Linnell who's another pharmacist. Linnell Hagan is a pharmacist that just recently underwent this process. And Linnell, I don't want to put you on the spot, but if you're on here, if you want to just kind of give a little, kind of your 2 cents on the process that you just went through it, if you're still on.
Yeah, I'm still on, Liz. As Liz said, I just went through that whole process. And all I did is I followed the CAP Center guideline, that document that the CAP Center has available. And it was actually not as painful as I anticipated, and it went pretty quickly. So just following all of those, different links and different things to look at, it went pretty smooth.
Thanks, Linnell. And then just one other note about the Medicaid expansion. Be looking for those emails from us and updates. We are hoping to kind of have a quick recorded session from someone from Blue Cross Blue Shield for Medicaid expansion as well. So we're going to be working with them to kind of do a similar thing as to what Jamie just went through, but on their end, and have that resource available to you to access that opportunity. So be looking through that for those announcements from us. One quick thing before we move on into the billing aspect, I did get one direct message, and maybe Lanika, you can answer this, but somebody had asked the question if there's a requirement to own or work in a pharmacy location, or if you can serve as a pharmacist as a consultant to participate in this.
Yep, nope, you don't have it. You can operate on independently. Like it doesn't necessarily have to be in a pharmacy that you're working in or anything like that. You can work independently. We've had a question like that before, whether or not you could basically subcontract out your service to another pharmacist, and that pharmacist could still enroll as a provider and provide services. They don't necessarily have to be employed by that pharmacy.
Great, thank you. So as Jamie kind of already alluded to, we're going to go next to have Jesse Rue talk with us a little bit about what the North Dakota Pharmacy Service Corps, North Dakota Pharmacy Association is implementing to assist us all in this Medicaid billing. So Jesse, if you're ready, we'll have you take it away.
Yeah, thank you. So first, I was just going to go and at the risk of repeating some of the things that Lanika went through in a very excellent, thorough presentation, just going to go and fly through a little bit of the specifics on some of the non-MTM type of billing opportunities. And again, we're going to just go very briefly to see what some of those codes look like. And also, I do have some of the reimbursement pulled off of the fee schedule that Lanika had been talking about. So next, please. Naloxone, that was discussed at length earlier, so we won't go and do much there, but just really just to rehash the, there is certainly some opportunities there for the pharmacists with being the prescriber on record with that. And I'll leave it at that. Next, please. Anticoagulation management for warfarin, I think something that's pretty exciting and something that's definitely a recurring need for people. There is a code specifically for that and the fee schedule on the right of 1176. Next, please. CGM, I think, is one of the most exciting developments in pharmacy in general, and just want to take a moment to really thank all the folks at the Medicaid office for having some confidence and faith in North Dakota pharmacists to really embark on this. It's really, really exciting. There are 3 specific CGM codes really listed in that medical provider manual, 95249, 250, and 251. The first 2 codes really are a little bit more in depth, and that's probably reflected in the payment that you see on the right-hand side. But 95251, super exciting for us just to talk about or be a part of, because that is something where the pharmacy can be paid for doing something. We're really checking in on what the CGM data has been, say in the last given month, for example, and making a plan with the patient for that. Very, very exciting code there. And that's a pretty good reimbursement at 3565. Next, please. Tobacco cessation has been talked about there. We do have the 2 different fee schedule amounts on the right, $15 and $28. Next, please. Drug administration and immunizations. So there are quite a few different codes here, but we're talking largely when we talk about administration of medication. Of course, everybody on the call, I think, is familiar with. Oftentimes there's a product or a drug side to some things, and then there's also the professional administrative type of fee, and that's what we end up seeing here on this. So different things, and I think it's not the most exciting presentation to go and read all of this verbatim. And again, this you can find this very, very easily in the excellent North Dakota medical billing manual. Next, please. A couple new ones here, and really give a particular thank you to Liz Skoy for really tracking this down. These codes are interesting in that they present an opportunity in certain circumstances for reimbursement for the time spent counseling folks on the need for certain immunizations. Now, if you do look into this, it is primarily in the under 21 age type of range, and these were largely invented during the COVID health emergency. But I think for some pharmacies, particularly those that are really involved in the VFC program or maybe interested in becoming more involved with that, this does in particular offer, I think, some pretty interesting ways, because it really goes directly to the heart of, I think, some of the things where pharmacy and other medical providers really talk about. Well, the time spent in counseling that may not result in a service being delivered specifically on that date and time. So there's definitely some things to unpack here, but really a valuable thing, and I think pretty unique for us to go down this road. Next, please. Then the next bit I'm going to show is not to get in depth with the billing mechanisms or different billing software or ways that you can actually go and put in some of these medical claims. At a really high level, I wanted to touch on a couple of things. And specifically because I think a lot of us, and if we're largely in the community pharmacy space as well, some of the professional medical claim terminology or just some of the basics of that is something that we may not have been exposed to much before. And I think we'll spend more time going into that in the future months to come. But just as a real broad introduction, for these medical claims that we've been talking about, there is a format called an 837, which you'll often see called an 837I for institutional or 837P for professional. These will be billed under an 837 professional claim. Certainly there are several routes available. There is some Medicaid options and documentation, which I think we can get put together and go into in depth in the future. But I did just want to go and show you a little bit that was alluded to. There is some software that's being tested now, and we're going to start some more rollouts here the latter part of the summer. Software a bit called Starfield, which is being created to really support all of this work from MTM to medical billing. And if we'll go to the next slide, I'll just show you really specifically a little bit on where somebody might be able to see in action some of these CPT codes, diagnosis codes, etc. So pretty standard looking dashboard here, and that's not really the point. The point is to say, if we look at the medical billing model, particularly in clinics and hospitals, it's very, very common for the note documentation to be extremely tightly linked to the claim submission. And that functions a little bit differently than what a lot of community pharmacy may be used to for the bread and butter with the reimbursement or the claim going through automatically at the switch for prescriptions. So now we're talking a little bit more about medical type of billing, documentation plus the billing portion tied together in a little bit different format. So the blue circle really represents adding a new encounter, which is something that might be a little bit more clinic type of base, but I think it's going to be coming more and more to all of us who work at community pharmacies as well. So next, please. So pretty standard type of things. We'll have the whether or not we're looking at generating a claim. There are different encounter types often if we're having an office visit in person, a telehealth type of visit, or a telephone type of thing. Very, very common to have some different areas there. And what's your place of service, your date of encounter, and then you'd have a section where you can go and write your note, because I think has been talked about, extensively in any of the manuals, but Nanika had definitely highlighted very accurately. There are specific documentation requirements for these various services that must be met, and those are auditable, certainly. So we do want to go and create systems or ensure that we're getting all of our documentation done properly and really in a similar fashion, no matter who your staff is. Next, please. Here's the exciting part. So we talked a lot about CPT codes, diagnosis codes, charges, units, etc. This is a very, very common type of layout if we're looking at a medical bill. So the first one over on the left-hand side is CPT code. Nothing exciting there. It stands for current procedural terminology. All it really means is what service are you delivering? And in the example, we have the CGM code for really what could be perhaps a monthly review and check in with the patient for determining what the next steps or optimizing their CGM therapy could be, 95251. Every CPT code has to really go and be linked to a diagnosis code. And those are based on something called ICD-10. There are hundreds of thousands of diagnosis codes that exist in the United States and across the world, actually. And that's something if we haven't had a whole lot of experience with, well, we can get you experienced in a hurry. But in this case, we have an E11.00, which stands for type 2 diabetes with a hyperosmolar ketoacidosis. Not really interesting, but the vanilla diabetes code may be E11.9. The units is how much of a given service did you provide? We did that one CGM 95251 visit for $35.64 in charges. So if I'm just going to recap that, we have the CPT code, which tells us what we've done, the diagnosis code that says the patient has this diagnosis, which validates that they may have a need for that particular CPT code service. We did 1 unit of that, and the resulting charge would be $35.64. 2 things which sometimes come into play, but not always, would be an add modifier, which there's quite a few modifiers, but sometimes that may have been some folks may be familiar with that from some immunization administration or also from some telemedicine type of things that they have done. It doesn't always exist, and certainly some payers don't end up using that, but it is an option. Sometimes it is required. Same with, to the bottom right, you'll see add rendering provider. When you're submitting medical claims, there are largely 2 different spots where the information can come from, I guess. You have a provider with your institution or your pharmacy or clinic, and sometimes you have a need for a particular service or payer where you need to directly go and report who the rendering provider is. And that would be somebody that's much more of a personal type of provider level. And that is an option, very easy to go and add that as well. So, oops, getting a little hand clicking through some things here on my screen. But yeah, that is what we have for the very basics of what a medical claim may look like. And again, we can definitely in the future go through it in a lot more depth. Next, please. And at the end, there would be the opportunity then to send charges, which is always a nice type of thing. There are opportunities, or there's the capability here with this bit of software to go and make very substantial edits if there's anything exotic that has to happen. But I think that the folks at Medicaid have got something put together that's very reasonable, rational, and really does not require anything too terrible out of the ordinary. So grateful for that. And that's where I'll leave it at the moment.
Thanks, Jesse. And like we said, be looking for further updates from Jesse and from North Dakota Pharmacy Association, Pharmacy Service Corps on Starfield. That as that gets rolled out, we wanted to let you know that, you know, if you're looking for a platform or a way to assist in billing, that is also being developed. So all of the pieces, all of the stars are really being aligned, from the changes in, you know, Medicaid and allowing and removing the prior auth to, you know, assisting and making it hopefully easier for you to become an enrolled provider through Medicaid, and the opportunity now with Medicaid expansion, and then of course now with the actual technical build. And so we're trying to make sure that we give pharmacy all the opportunity that we possibly can. So with that, we will open it up to any questions that anyone has. Lisa, I don't know if you got any through direct messaging or not.
Hi, yeah, thanks, Liz. We don't have any that haven't been addressed yet through messaging. So if anybody wants to unmute or type in the chat very quick. One thing I did want to add, it kind of is related to when Jamie was talking about signing up as a provider. We've had reports that it had taken previously maybe 3 to 4 months to get all of this paperwork done and get responses. And now that's gotten down to just a couple weeks. So they've caught up, and it's been a significant improvement. So that's really a good thing as well. So that's good to hear. Good job, team.
Thanks. Yeah. So if I can just kind of almost create a little bit of challenge for everyone on the call today, is maybe just to go through and click the link and at least maybe start the process for enrolling and get your number and go through that. Lisa, did you have another question or item that came up direct message?
One just popped in here. The question is the follow-up phone call still required for the initial 99605?
Yep, it is.
Perfect. Thank you. Another question? Oh, Brody sent something in the chat. Okay, thank you, Brody. That was to everybody. That's all I have, Liz.
Yeah, does anyone, I just had one other question from someone direct messages. Does anyone have any recommendations or resources for billing platforms, that secure platforms, so delivering virtual services. And I don't know if, as for, I know like for the billing component, we have Starfield coming, and I know that Lanika, correct me if I'm wrong, but I believe DocStation as well as MTM Express are both approved through currently, although Starfield will be eventually replacing MTM Express for billing. Is there anything else that I'm missing?
Nope, we don't have any specific requirement for them to use a particular platform. The things that we expect a platform to be able to do were outlined in that manual before, but yeah, MTM Express is certainly acceptable. DocStation's acceptable. I know some clinic-based pharmacists do their documentation within Epic as an example. So EHR platforms are something that we've tended to allow as well. So I don't want people to feel like if they're in a clinic that they're limited to those softwares either. So, yep.
Yeah, that's a good point. And as for the virtual, oh, Jamie, you were gonna go on, please do for the.
Oh, I was just going to mention, depending upon which documentation system you're using, not every documentation is set up to bill the claims directly, like MTM Express isn't. But Medicaid does have a great platform in their MMIS portal. It's an online portal. It's free to use for all Medicaid providers. You can set up billing templates within there and everything. So you can do your documentation in one place if you need to, and then do your billing within MMIS.
Wonderful. And as for the secure virtual platform for services, I think there's just a variety of different available telehealth or, different HIPAA compliant virtual platforms available. So just be a matter of what fits your individual budget or needs.
One more question for Lanika. Which Medicaid services can be provided by telehealth? You already mentioned that the manual talks about this for MTM. Are there other services that can you quick over that again, please?
Yep. So rather than go through all the different types of services, I would just refer anyone who's looking to do telehealth back to that general information for providers manual, which I gave you the landing page where you can link to that. That's going to talk about telehealth services, and then it also has telehealth covered services in it. So it links you out to all the things that you need. So that way you can, based on whatever it is that you're doing, you can find what you need there. And then if there's further questions, certainly you can reach out to me independently for any additional specifics. So.
Wonderful.
Thank you. No further chat questions.
Okay, that sounds good. And we have the contact information up here. Again, be looking as we send out additional resources and links, as well as we'll be putting this recording up on our website and emailing that out too. So, for those of you that have joined us today live, that's wonderful. If you want to review, that link will be available. I know there's a number of pharmacists that, just due to the nature and the time of today, that they weren't able to join, but this will also be available virtually to them. So thank you all so much for attending today. Thank you to our presenters. And we really hope after this that we will be checking in with Lanika and the team at North Dakota Medicaid. And we kind of hoping to see the number of North Dakota pharmacists enrolled as Medicaid providers increase. So thanks so much today.